as a birthing person, your whole goal is to keep your mind calm. Keeping your mind calm and letting your body do the work of bringing your baby earth out. You don't want to worry about being too loud or being too animalistic, what have you. You want to do the things that naturally feel good to you. If you feel like growling, growl. If you feel like groaning, if you just feel like flailing your arms, I want you to do what feels comfortable for you. Because when you start to get in your head about how you're feeling and what you're saying and how you're sounding, then that's going to possibly stall your labor because your body can get into a state of arrest. You'll be extremely anxious and you'll tense up. So you're not able to relax and release and allow your body to do what it needs to do to bring your baby earthside. Some things you can do to be as comfortable as possible while laboring are, for one, let's think about temperature. You can get hot and you can get cold during labor, and it can go back and forth. So dress in layers and think of things that you can remove and take off, and also things that you can put on. Think of where you feel most comfortable. Is this your living room? Is this the bathroom area? Is this the hallway? If you're in the hospital, ask, what places can I go? How can I move around? Where can I transition to be more comfortable? You can dim your lights. When you are in labor, your eyes become very sensitive to light. So it's very helpful to dim the lights. If you're in the hospital, ask about turning the lights down. When your staff comes in and they have to turn the lights on, just ask when they leave, can we turn the lights back off? Also, some things you can do are aromatherapy. But make sure with aromatherapy, you are very aware of what oils are safe during pregnancy. Another comfort measure is walking. Literally just walking is great for movement and it's great to help baby come down. So let's talk about energy and why it's huge and a major part of getting you through your labor process. So when it comes to food and nutrition, we know that's everything for your energy. It's great for your brain because when you're tired and you're exhausted and you're weak and you're also hungry, it's going to be really hard to make the decisions that you need to make. Also, you're extremely vulnerable. So you may not be thinking as soundly as you would prior to. Staying hydrated and having nutrition is great to allow your brain to actually make better decisions. It allows you to have more clear thinking, more sharp thinking, and you just overall feel better because you have more energy. The further you go along in the labor process, the more fatigued and the more weak you become, which is why you really need your nourishment. Birth plans are extremely important to reserving your energy because instead of fighting and instead of going back and forth, you can literally continue to say, please refer to my birth plan. And that's important because when you made your birth plan, you were in your sound mind, you were not exhausted, you were not tired, you were not vulnerable, and you were not in labor. If you have support persons with you, that is amazing. It can be your family and friends, it can also be your partner, and of course your doula. If you have a doula there with you, they are trained professionals and they know how to support you, when to support you, and what tools and resources to use. When it's your family and friends, you also have the ability to be able to express to them, these are the things that I need when this time comes. Okay, let's talk about one more thing. It's a small thing, but it can make a huge difference when it comes to comfort. Wear your own clothes. Literally, pick out clothes that feel good, that feel comfortable, that are loose, that you have layers. That will give you a sense of security and comfort, especially if you're in the hospital, because it'll be an item of familiarity for you. And also, you will know how these clothes function, how you can move in these clothes, and how they feel. Just something that small is still great for the process. It's familiar, it feels good, and your clothing will even have the smell of your own home. And familiar smells can bring you to a place of security. It can ground you and bring you back to center. Before you start, doulas are not against epidurals. We are against you not being informed before getting an epidural. You should know all the benefits and you should know all the risks, and you should be able to ask those questions and get full explanation before making a decision. You should not be forced, pressured, or rushed into making a decision. So let's talk about what an epidural actually is. An epidural is medication that is inserted via a needle into your back. The needle is about yay long, and it may or may not work. But if it does work, you will not have any feeling, most often from your waist down, which means you literally won't be able to feel anything. And you won't be able to control your legs because they will feel limp. So your mobility will be reduced. You will be attached to an IV pole, and you will not be able to get up out of the bed and walk around. You also don't feel when it's time to push your baby out. You literally have to listen to someone counting and saying, okay, let's push now. Versus when you don't have an epidural, you literally feel your body telling you it's time to push. You actually feel the discomfort. You feel that moment of, okay, I feel like it's time to push now. Outside of that, you wouldn't know that if you had an epidural. Now let's discuss an induction. An induction is a false start of labor, and this can be done with the use of medication. Medications by IV or tablets that are placed in the vagina. It helps to ripen the cervix more quickly so that we can get you into labor and bring baby earth out. Inductions are most often used when people have labors that are being stalled, or like they say, failing to progress, or this can be a scheduled induction for various reasons that are determined by your provider. An induction, yes, it speeds things up, but mom and baby both have the possibility to be in more distress. So make sure you ask your provider, is this induction necessary and do I really need it? Or can I continue to labor a little longer safely? Another comfort measure I want to discuss is taking oral medication, which is medication by mouth. So this is literally pain medication in the form of tablets that can help with the pain or the discomfort. Most often, you will be given this in the earlier part of your labor. But again, this is at the discretion of your provider. And if you feel you need it, you can ask for this prior to other interventions. With any use of intervention, always remember, start low and then progress up. Also, you want to do what feels good for you, what feels safe for you, and what's best for you and baby. However, never allow these words to make you make a decision that you don't want to make. You want to do what's best for your baby, right? You want to make sure you're safe, your baby is safe, right? You don't want to harm your baby, do you? You don't want your baby to die, do you? These are all words and language that can cause fear in a mom or the birthing person. And it can cause you to make a decision that you're not comfortable with or that you're not ready to make. So again, do what feels good for you, but what's also safe for you and baby, but know that you innately want to do what's best for your baby.